The next stage is theory-based methods and practical strategies. I hope you are looking back at your steps or tasks that you took and see where you can improve an input. The next is, of course, theory, methods, and practical strategy. You need to decide on which theory and how you're going to deliver that theory, and what are the practical strategies you're going to use for that theory. Of course, I will not spend much time here because you're already well versed in many different theories, but planners seek theory-based methods and practical strategies corresponding to the change objectives. So this is the most important part. The theory should directly relate to the change objective. Because you have a determinant of the change, you have the performance of the objective, then you have the change objective. So you want a theory that will address directly the change objective. This is what helps you to actually narrow down the theories and get to one theory that best suits what you want to do. And at this point, I want to say that actually, okay, let's continue. So next is planning group. The planning group helps in deciding or selecting the behavioral theories as well as the practical strategies. So you get these people to sit in a place and you discuss the change objectives that you've identified, and then you discuss the theories that are related to that, and then you go to a very systematic way to deciding which theory is going to be used. And then the bottom line is to ensure that selected methods address the change objectives, and selected methods should be acceptable to the target audience. Remember, you are targeting a win-win situation. A win for you as an organization or as a designer of the intervention, and also a win for the person who's going to receive the intervention. It's not enough to just design the intervention. It gets completed when you have acceptance and usage of the intervention by the audience and positive feedback. So this is what guides you on what will be your methods and what will be your strategies and what will be theory you would use. So in Swazi Yolo, we used the theory of planned behavior, specifically the intention, the intent component of that theory, and the health belief model, focusing on the perceived susceptibility in that model. We identified intervention platforms as Android operating systems. So remember, you need to figure out the strategy that you're going to use to reach your audience. So in our needs assessment, we realized that many people are using an Android phone versus all other phones. So we decided on Android operating system. And then we determined that our intervention would be a role-playing, story-based game. Remember, at the start, we just knew that, look, we wanted to create a game to involve them, but we had no idea what kind of a game would be effective. Do we run a simulation? Do we run a shooting game? What type of game? We didn't know. So we only had ideas about this after consulting with the stakeholders and consulting with the game developing company as well as the target audience. And we decided on strategies, the point system, the reward system in the game, and also ensure that the game addresses the change objective is very important. So we linked key decision points in the game to our evaluation plan. So this is also a very important component because evaluation step is at the end, right? But the beauty of this model is that you don't start evaluation here. You don't start thinking about evaluation here. You finalize evaluation at this stage. But all throughout the process, you think about evaluation. Actually, the model is something like this. or the opposite way, like this. So you think about evaluation throughout, you end up having a process that is not just one way, you move through steps like that. Okay. So program design is our next step number 4. And in this step, also you conduct it in consultation. The interesting part in the program design is that your preconceived ideas might be changed. So you might decide very well that, look, I want to change adherence. And the reason for people that are not adherents is that they forget. But after this deliberate process, you may discover that, look, people are not taking drugs because they don't have food to eat. For example, one of our researchers in the lab found out that there was people who were not adherent to antiretroviral therapy related to food insecurity. So it might change the way you think. Previously you just thought, if we just tell them that it's important to take drugs, people will automatically take drugs. So the problem is not knowledge or it's not forgetting. It might be other program. So at this stage in the design, you actually realize that your preconceptions about the problem is a little bit different about what the actual situation is and what the audience prefers. The mode of delivery might be very different from what you previously thought and what the people actually prefer to have. Okay. So you involve stakeholders. At this point in the program design, it is when you design the themes, the kind of broad topics that you want the game to achieve, the intervention to achieve, and the content. If it's a story, what will be the story? What will be the story about? What will it be about? And the scope. What do you want to address? By this time, you would have identified many issues, many determinants of the issues, but you want to scope it down. You want to directly focus on what you will try to focus on. And also the sequences of events, right? So do you want to start with knowledge, perception, or you can just start with perception? You decide during this stage. So at this stage, expect the design plans to evolve. It's a living document. They will change throughout the intervention. So by nature, this step is really interdisciplinary. You, as an epidemiologist or public health official, is not enough. You need expertise from game developers. You need expertise from computer programmers or graphic designers, people who know about project management. So you need to be able to consult and work across teams in a way that you both agree on timelines, on what the costs will be, the expenditure will be, when the deadline of the project will be. Everything you need to decide at this stage, but of course it can change later on. So in Swazi YOLO, we prepared the documentations when we were in this stage. There are many documents that you need. As you can imagine, there's something called a game design concept note or the design document, and there's the study protocol, you know very well. The concept note, the design document, is almost the same as a study protocol, but they're a little different. So this one is largely done by the programmers. They explicitly state in this document how the game will be, even before they start creating it. So you can see it on paper. I have close to 150 pages of this document. And then the study protocol and the terms and conditions of the game use. I was very surprised that I didn't know about this until I was actually at this stage, that I needed to have the terms and conditions for playing the game. I needed to consult with a lawyer. I didn't know any lawyer. Going through university process might take a little bit longer than the time I had. So it was very difficult. But I needed to, design legally sound terms and conditions for playing the game. So at this point is where you come up with this. And then also you start, thinking about the promotional brief, the document that you will give marketers or people in the marketing company to design for you. So you need to think about this. You need to write it yourself. You need to be able to write it yourself. I will show you how you come up with that. So the characters in the game were based on the target audience. So we segmented the audience because I mentioned before that the story is not just one story in Swazi-Yolo. It's many different stories. The next scene depends on the decision the player takes in the previous scene. So we needed to design this very close to the target audience, right? So the story is based on the day-to-day life of events in the target country. The language of the story also is developed to mirror the target audience. For example, we use a lot of short language. So for example, there's a lot of to. For example, in the game, we write to like this, right? But everyone else in our target audience writes to like this when they're typing or when they're on social media. So this kind of short lingo that is popular in social media and other forms of online platforms, we needed to learn and actually incorporate in the game, because that's what we learned from the target audience. The first brief, we produced this huge story, properly written language, but it was a bit not so palatable to our target audience. And then also the game has got music. Each scene has got a different sound to it. So it mirrors, it tries to capture the emotion of that scene. And then we also tested the game. This is very important. We conducted alpha and beta test. Alpha and beta test are different levels of the game, the development process of the game, to identify problems and things like that.